So this is going to be a position to work on hip rotation. Some people have pain with hip rotation when their knee is up towards their chest. This is a better position because their hip's in extension, so it doesn't put as much pressure on the front of the hip and groin. So you want to lay against the wall, and I'm going to be focusing on doing this with my left leg, so the leg closest to the wall is the one I'm going to be paying attention to. Now I want to minimize pressure in my back. Some people, if I put them on their stomach and their back is really arched, I may put a pillow under their stomach, or at least encourage them to lay as flat as possible, right? I'm probably gonna look up at you so you can hear me talk, but just know that I wanna try and keep my forehead probably down and trying to keep a little maybe tension or like pelvic tilt if possible to try and avoid excessive arch in my back. So I'm gonna bend my knee, and in this position, I'm gonna work on a little bit of isometric of my foot pressing against the wall. In doing that, I wanna feel like I create some tension in my stomach first, so that as I push, I don't wanna feel like that pulls my back out of position. And I'm gonna hold that pressure into the wall for about 5 seconds. Then I'm gonna bring my other foot up so I can push against my other foot, basically squeezing my feet together for about 5 seconds. So this gives me a little way to resist internal and external rotation of my hip to create an isometric muscle contraction. Hold each one for about 5 seconds. Now after I've done maybe 5 to 10 of these, I like to have patients slide away from the wall and then just go through as much active motion as they can, especially in internal rotation. So I'll have both knees bent, and I'll slowly let my feet go apart to where I feel any pain, tightness, or limitation, and then just come back in. So it's just a gentle way that I can work in and out of internal rotation of my hip, in between going through some movements where I create that isometric tension against the wall and against my other foot.